Today we are talking about hip and pelvis, which is a part of the lower limb. So today we are specifically describing the lower limb. So as you can see, you have pointed out the lower limb over here. And now what are the parts of the lower limb? As you can see here that I have drawn the parts of the lower limb, which is the hip and pelvis. First is hip and pelvis, second thigh, third knee, fourth leg, fifth ankle and feet. You can take it down as your notes, it can help you out in the exams. So first thing is we describe is hip and pelvis. Hip and pelvis, it is made up of hip bone and the pelvis. Both are very different. Hip and pelvis, it is very different, and it is one of the most biggest ball and socket joint. Which one? The hip joint. The hip joint is one of the largest ball and socket joint. You can see over here I have inserted a picture that this part, this is the pelvis. This part is the pelvis. You can see that it's a unique shape, right? And it is, we'll name the parts later. You can see this is the pelvis and this is the hip region, and that's why it is called pelvis and hip, because this is the pelvis, two bony structures, and hip, it is just a joint. It is just a joint, ball and socket joint. Now we come to this hip and pelvis. So it is very important ball and socket joint. Second, connects thigh bone, femur to pelvis. Look again, thigh bone connects the thigh bone to the pelvis. So what is it? What is it? This is the hip joint. This is the hip joint which connects the thigh bone to the pelvis. So this is the hip joint, it connecting the thigh bone to pelvis, which is also known as the femur. And now it also helps in flexion, extension, abduction, adduction, rotation. We will discuss about it. I have drawn a structure. You can see flexion. Look, when your hand is in this position, straight position, your hand is in, suppose I draw a man and this is the hand, right? If this is the hand, when you move your hand in this direction, your hand will be in this position after some time. When you move in like this, in this position, this is called flexion. And if you do the reverse again, one second, if I take like this, the man, his hand is in this position, it goes back to this position, comes here, comes here, comes here. So the reverse process is called extension. This is, I'm talking in case of the upper limb, not the lower limb. I have even drawn a structure for you guys in the bottom, where I will show you the extension and flexion of the lower limb, which is the leg. And even you can see the rotation, there are two types of rotation. One is the external rotation, one is the internal rotation. And even we'll talk about abduction and adduction later. So what is the difference between hip and pelvis? Do you have any idea what is the main difference between hip and pelvis? Because both are not the same. Both are not the same. So as I mentioned, hip is the ball and socket joint which connects femur, which is the thigh bone, to the pelvis. It connects femur to pelvis. And what is pelvis? Two bony structures made of three bones, ilium, ischium and pubis. So remember these three, which is very important for the exam: ilium, ischium and pubis. So the question they might ask in your exam, what is hip? It's a ball and socket joint. And what is pelvis? two bony structures made of ilium, ischium and pubis, which are the three bones. And now if we come to this part, what are the there are few important vascularization also. Later we'll go on deep, and now you can just learn the names, that common iliac arteries, internal iliac arteries, femoral artery, gluteal arteries, obturator artery. You can take a note of this, while you make your notes, take a pen and paper, and then you can take a note of this part. It will help you in the exam. Or I'll leave a PDF for you guys at the end of the video, and I will be opening my website very soon, where you can find these videos, and I'll be uploading the notes, and you can use it for your exams or to give it to your friends, to do anything, if you want. You can see the arteries: common iliac arteries, internal iliac arteries, femoral artery, gluteal arteries, obturator artery. And the veins, if you tell me what are the veins, see, arteries I always mark arteries in red, to be honest, because arteries are red. I always mark arteries in red, and veins in blue. Veins in blue every time. The veins in blue. So the same veins as arteries, you can change. The common iliac artery is common iliac vein, internal iliac vein. Just change the arteries to veins. That's it. Internal iliac veins, femoral vein, gluteal vein, obturator vein. That's it. And now we come to nerves. Sciatic nerve, you can tell, sciatic nerve. It originates from lumbosacral plexus. I'll write for you as well. Lumbosacral plexus, and opens up from where? Opens up from the greater sciatic foramen. It is a foramina. It is a opening through which the nerve passes, not originates, through which the nerve passes, and it is the greater sciatic. It is asked in exam, and I have been asked in the exam also this time, so I'm repeating again: the greater sciatic foramen. It passes from actually behind, from the behind of the pelvis, and comes and passes to the greater sciatic foramen. And it is the longest and thickest nerve in our human body. Now we come to the femoral nerve. We will discuss later. One by one we will discuss, and I will create a playlist where there will be description for each one of the nerves, so don't worry. Femoral nerve, obturator nerve, supragluteal nerve, inferior gluteal nerve. So just take it down, it will help you out. Take all these down, or take a screenshot, take a photo, something. It will help you out in the exam. Now I have drawn this for you guys. I have personally drawn this figure for you guys, where I'm showing that this is pelvic bone. Pelvic bone, yes, pelvic bone. See, you can see that this is the sacroiliac joint. It's a very important joint of the pelvic bone, sacroiliac. Always write down the name. Why it is called sacroiliac? Because sacrum plus ilium. Sacrum plus ilium. It is called sacroiliac joint. Why it is the ilium? This is the ilium. This is the iliac fossa. Iliac fossa, you can see this is the iliac fossa. This part you can see the iliac fossa, and this part is the sacrum. This part is the sacrum. This part is the sacrum. You can see, and this joint you can see is the sacroiliac joint because it is joining sacrum plus ilium. This is called sacroiliac joint. This you can see this is the part coccyx. Remember coccyx. I'm writing it down, coccyx, sacrum. These holes are called the alar ligaments. You can see alar ligaments. These holes, or this part, these are called the alar ligaments. You can see here this is the acetabulum, right? What is acetabulum? It is like a fluid like space where this connects the thigh bone. Actually from here the thigh bone is formed. From this part itself the thigh bone is formed, the femur arises from the acetabulum, remember for the exam. And you can see this is the ischium. Actually this part is called the ischium and this part is called the pubis. This part, well, I'll draw in red, you can understand. This part is called the ischium, this part is called the pubis. And look, one pubis, two pubis, one pair of pubis joining by how? The pubic symphysis. Look, pubic symphysis. In this part you can see pubic symphysis. Okay, and ultimately you can see this part is almost over. And remember the border of the ilium, it is called the iliac crest. And when you come a bit down towards this part is called the iliac tubercle. Acetabulum, through which the femur rises, the pubic symphysis. That's it. And now we come to the flexion. As I told you before in the upper half of the video that I will be explaining you the flexion and extension of the lower limb. Lower limb means what? Leg. You can see our leg is in this position. When we move it back, this from the hamstring part, you can see from the hamstring part, this is the hamstring part, and from the calf part, this is the calf part. Calf muscles, I am very sure you have heard of this. Calf muscle, hamstring part. Hamstring in football injuries are very common. Hamstring injuries in football, when you go to play football, hamstring injuries are very common. Even calf injuries are very common. So when you move from the hamstring back, you're moving back, folding, bending and moving back, that part is called flexion. This part is called flexion. Moving back, it's called flexion. And when you do the same thing in reverse, that is going from like this to this, I'll take the yellow, from this to this, back to forward, which is called extension. So if I give an example, one second. No, not this, yes, this. This is a man. This is a leg. Look. This is the man, this is the leg. The leg is like this. It's like, imagine the pendulum of a clock. Goes back, flexion. More back, flexion. Do the same thing reverse. The leg comes here, extension. Here, extension. It's very simple. Back, flexion. Forward, extension. That's it. Look guys, as I have told you before that this is the pelvis part. Can you see how it is designed? The intestine, the pelvis, look, guarda, pelvis, the ligaments. And now when I say you look, this is the ilium, the whole part, look, this is the ilium. Can you see the ilium? And now look, this is the pubis part which I have drawn and showed you, and this is the ischium. The three parts of the pelvic bone: ilium, ischium, pubis. I'm repeating again and again. Look that the ilium and the pubis is again joined by a ligament called inguinal ligament. Look, inguinal ligament. See. Inguinal, we have one pair of inguinal ligaments. And now look, this, you can see this is the femur, and here right inside this, if I dissect this part, I will dissect it for you, and you can see in this part, look, this hollow region, can you see? This is the acetabulum. This is the acetabulum from where the femur arises. So it's also an important hip joint. I told you, the hip joint which connects pubis with, or you can say the pelvis, it connects the pelvis with the femur. So this is called the acetobulum, or you can call the hip joint. It can, because it connects the pelvis with the femur. And now you can see, as I have talked to you about before, about the arteries, right? So say this is a very common aorta, which is aorta, one goes up from the heart and one comes down towards the abdomen. You can see it divides into common iliac artery and this, even the common iliac artery. Now you can see this is the internal iliac. You can see here, even here, the internal iliac artery. Internal iliac artery. Let me dissect this 1 second. Yes, see internal iliac. And now you can see that this is the external iliac. So I will again draw you the structure in the next video and try to make you more clear the pathways which are very important for the exam. The internal iliac, the common iliac, the internal iliac, then external iliac, and then from external iliac it comes to the femoral. Look, femoral. Can you see the femoral artery? Huge artery, femoral artery. Even this, look, this is the femoral artery. From where? The external iliac. It arises, femoral artery arises from the external iliac artery. Remember this every time. And then you can see that the femoral artery even has many branches. Is the profunda femoris, which we'll discuss later. Deep femoral artery, its origination, its function, everything we'll discuss in the next video. And I'll show you one more thing. Can you see this is a sciatic nerve? I have told you before. Sciatic nerve. Look how thick it is. How thick the sciatic nerve it is. And let me dissect the gluteal muscles first. Look how thick it is and from where it is arising. The sciatic nerve. This is the sciatic nerve. I told you it comes from behind and passes. Can you see this part? This part is the greater sciatic foramen. Remember, greater sciatic foramen, sciatic nerve passes through the greater sciatic foramen. It is a very common question asked in the oral exam in MBBS. And it has branches. One is the common fibular peroneal branch and one is the tubular branch. We'll discuss tubular branch, we'll discuss in the next video. I hope you enjoyed this video and you have understood enough what I have tried to explain. If you didn't understand, you can comment down below and I will explain again in the next video. So don't worry guys. Thank you so much for watching.